Okay, so hello everyone. Today we will talk about the axillary nerve. So you know that axillary nerve, it supplies basically two muscles of the upper limb. One is your deltoid and another one is your teres minor. Okay, so these two muscles, they are supplied by this nerve which is known as axillary nerve. So ये बहुत ही important nerve है. Let's talk about the origin and root value of the axillary nerve. So it is arising from the posterior cord of the brachial plexus. You know that the posterior division of whether it is you can see all the trunks that is your upper trunk and the middle trunk, upper trunk, middle trunk and lower trunk. The posterior division of all these trunks, they form a posterior cord, and from this posterior cord you have uh, almost 5 branches, out of which axillary is one of the branch. So axillary nerve is the branch of the posterior cord of the brachial plexus, and if you talk about the root value for axillary nerve is C5 and C6. So in your exam, you are asked about the root value of the axillary nerve and also from where it is arising. So axillary nerve arising from the posterior cord of brachial plexus, and the nerve root value of the C5 and C6. Let's see the course of the course of the axillary nerve. So it is arising in the axilla, the branch from the posterior cord, that is your axillary nerve. It is beginning in the axilla, then it runs backward. You can see here it is arising over here. This is the posterior cord. You can see this is the posterior cord, and from the posterior cord you can see a branch over here, going posteriorly. This is behind the third part of the axillary artery. You can see this is the branch which is your axillary nerve. Then it runs backward in close relation to the capsule of the shoulder joint. Then it passes through this quadrangular space. You can see here there is a quadrangular space over here. This is the quadrangular space. Okay, teres minor, major, surgical neck of humerus, and the long head of triceps. So in between these four structures, you can see here this is the axillary nerve coming out through this quadrangular space. This is the upper triangular space. You can see the cut section of the minor muscle. So this is the upper triangular space. Okay, this is the upper triangular space, and here you can see this quadrangular space that is bounded by the teres minor, teres major, long head of triceps, and the surgical neck of humerus bone. And from this quadrangular space, you can see the axillary nerve is coming posteriorly. Then it terminates by giving the anterior branch and the posterior branch. The anterior branch, it runs along with an artery, that is your posterior circumflex humeral artery, which is the branch of the third part of axillary artery. Axillary artery की third part से ये arise होती है, that is your posterior circumflex humeral vessel, and this posterior circumflex humeral vessel is going to accompanied by the anterior branch of axillary nerve. Then it winds around the surgical neck of humerus. That is why you know the injury of the surgical neck of humerus can lead to the injury to the axillary nerve, and that can lead to paralysis of the deltoid muscle. So this axillary nerve, it winds around the surgical neck of humerus, then it goes deep to the deltoid muscle and supply the deltoid muscle. The posterior branch, you can see here, the posterior branch, it pierces the deep fascia along the posterior border of lower part of deltoid muscle. You can see this is the contour of the deltoid muscle. So you can see here the posterior branch जो है ये आपकी run करती है along the posterior border of the lower part of deltoid and continues as upper lateral cutaneous nerve of the arm. It continues as the upper lateral cutaneous nerve of the arm. So this is the course of the axillary nerve. So this anterior branch of the axillary nerve, it is going to supply the deltoid muscle and the skin over its anterior inferior part. Suppose this is deltoid muscle. So this deltoid muscle is supplied by the anterior branch of axillary nerve. Beside this, the skin over the anterior inferior part of the deltoid muscle is supplied by the anterior branch. The anterior inferior part is supplied by the anterior branch, while the posterior branch, it supplies the teres minor muscle, part of deltoid muscle, and it carries a pseudoganglion. So in your exam, you may find question like which of the following nerve forms the pseudoganglion. So there are basically two nerve. One is your axillary nerve and the one is your radial nerve. So these two nerve of the upper limb, they show a special feature, that is your pseudoganglion. What is pseudoganglion? Basically, you know that ganglion. What is, first of all, what is ganglion? Ganglion क्या है? You know that collection of nerve cell body outside the nerve CNS is known as ganglion. Ganglion जब भी आप देखेंगे, so you can see in a form of spherical rounded elevation. So this is pseudoganglion, means that is not a true ganglion. It is falsely looking like a ganglion. That means this axillary nerve, the posterior branch of axillary nerve, the fibers are getting thickened somewhere in its course, and this forms a rounded thickening elevation, and this is known as pseudoganglion. So in pseudoganglion, you may not find the nerve cell body. These are the axonic fibers. So this is known as pseudoganglion. Then this posterior branch continues as the upper lateral cutaneous nerve of the arm. This continues as the upper lateral. You can see here, this is the posterior branch of axillary nerve. You can see the pseudoganglion over here. It supplies the teres minor muscle. So this is the teres minor muscle, and the pseudoganglion on the nerve of the teres minor form the posterior division, which continues as the upper lateral cutaneous branch of the axillary nerve. So this is the course and the supply of the axillary nerve. You can see here, this is basically the upper quadrangular space. This is basically the upper quadrangular space where you can see this is the anterior branch and this is the posterior branch. Okay, so you can see here you can see the posterior branch, it is going to supply the anterior branch supplies the deltoid muscle, while the posterior branch, it is going to supply the teres minor muscle. It is having a pseudoganglion over here. So this is how the axillary nerve is arranged. ठीक है, ये सब axillary nerve की branches. तो ये आपको एक line diagram जहाँ पे आप देख सकते हैं C5 and C6 are basically the roots of axillary nerve. They unite and they form axillary nerve in the axilla. Axilla में आपको axillary nerve मिलेगी. Then it gives branch to the shoulder joint, and then it goes posterior side where the posterior branch supplies to the teres minor muscle, while the anterior branch supplies the deltoid. The deltoid is supplied by both anterior as well as the posterior branch, and this anterior branch also gives cutaneous branches to the skin over the anterior lower part of the deltoid muscle, while the posterior branch supplies the posterior part of the deltoid, also the teres minor, contains pseudoganglion. The branch which is going to supply the teres minor is having pseudoganglion, and then it continues as the upper lateral cutaneous nerve of the arm to supply the skin over the lower half of the deltoid. So this is the course and the branches of the axillary. So in case of any fracture of the neck of the humerus or the injury at the neck of humerus, the axillary nerve get injured. So this axillary nerve is going to be injured, and because you know that axillary nerve is going to supply the deltoid muscle, so you will find the paralysis of the deltoid muscle. So you know that your rounded contour of the shoulder is formed by which muscle? This is formed by the deltoid muscle. So in case of deltoid is paralyzed, there will be no contouring of the shoulder. So the side of the nerve paralyzed, you will find there is dropping of the shoulder. You will not find the rounded contour of that particular part of the shoulder. Okay, and then there will be loss of the abduction, because you know the deltoid is responsible for the abduction up to the 90-degree. The abduction is caused by the deltoid. So deltoids, because it get paralyzed because of the injury of the axillary nerve. So you will find the loss of the abduction. So the patient cannot abduct his arm. And then there will be sensory loss in the area of the anterior and inferior area of the deltoid muscle, and this is known as badge area. So you will find a sensory loss over the badge area. So these are the features of the injury to the axillary nerve and deltoid muscle paralysis. So this is about the axillary nerve.